One is actually a comment, which is, I feel that there was a common theme today, which is something we all really talk about here quite often. There is a critical connection that is going on within, I guess, integrative medicine. And it seems to be the future of medicine, but maybe also the future of education. And learning in a silo was something that really hit home. So thank you for bringing that up, Lisa. But everybody, thank you. And this question is for Dr. Siegel. Is there a certain way to ID a posterior tongue tie, one that is readily apparent?
It's not an easy thing. It's not an easy thing for us to do sometimes, but for a parent to do themselves, it's really difficult. Like I was trying to explain up there before, especially with babies, we try to come from behind. We try to really, sometimes you feel it more than see anything. And it really, I think the best way to do it is have your suspicion, have it evaluated functionally by an IBCLC, like I'm going to give Lisa a plug here, because they're the ones who really determine if there's a functional problem going on, because we just don't treat how it appears, but we want to treat function. And the same goes for the kids on the bottles, so if we're dealing with somebody who's not breastfeeding and they're not seeing a lactation consultant, or they may be dealing with a feeding therapist, and we deal with some of the SLP feeding therapists who are very knowledgeable. We ask for them to assess function first. And although they can't diagnose, quote unquote, we depend on their input, and they should be able to diagnose, and you do give a diagnosis based on your assessment. So not an easy answer, but I think those routes first, and then seek a provider that's experienced in the whole area too.
Can I add to that? So shameless plug, I have a course, and the first module of the course is all about assessment, and it's not about examination. It's all about signs and symptoms, and signs and symptoms in the mother, the baby, and the feeding. So I treat it like it's 3 different patients and evaluate it that way, and there's checklists to go through. Because you can't look and see what's going on. I've seen mouths that I have no idea how this baby is extracting milk, and they're doing wonderful and there's no symptoms. And then I've seen babies who can't nurse at all, and we can't visibly see a frenum. So it's more about that. And I loved when Dr. Siegel was saying about how he doesn't use the numbers, and he knows I don't either, because I don't send him a report saying he had a class 3 this and a class 4 that, because the different scales contradict each other even. 1, 4 is the worst, 1, 1 is the worst, so it's very confusing. What I do is describe what I see and what I feel in my evaluation. But so my course is open to all members of the healthcare team, because as you see, most babies never get to a lactation consultant. So I feel like it's really important for everyone who sees babies to understand and to recognize it and to know what to do when you find it. You may not be treating it, but you know who to send it to and when to say, oh, that's definitely not it, because this isn't going on, or that's not going on.
This is just a general question. So some of the ties that were up on the screen before, at the bottom, there's like, it looks like a ball, kind of like a cluster. Mm-hmm. Someone once told me that meant that a tie ripped and it kind of rejoined. Is that true, or what?
No,
is that?
What you may have been seeing were the ducts of the salivary glands.
Okay.
The submandibular, yeah. I think that's what you may be talking about. On either side of the frenulum is like little. If it's further down towards the floor of the mouth, it's usually the ducts of the salivary glands. But sometimes you can see a little tag that may have been, a partial tear or something like that.
Okay, thank you.